Jim Joyce. It's Wednesday. We survived, woke
It's a
up,
big week.
and it's a huge week, honestly, for the whole world. And I'm actually, this morning, I decided to put on, when I saw the news, I did not stay up, Don't Hate, Meditate t-shirt. That's it.
Perfect.
Just, we got to move on
Perfect.
and keep acting. And that's it. With that, I'm going to let a dear friend, mentor, colleague, investor,
Seems like
Mr. Glen
it's a
Tullman
lot of
in.
roles. Yes,
I know
a lot
many
of roles
many
for the
roles
guy,
for for
the poor
Glenn.
guy.
We just assigned him a few more.
Hey guys, apologies for being late. As you might imagine, it's a bit of a unplanned, crazy day.
Oh, we can imagine. Welcome, and we're gonna dive right in. Glenn,
Okay.
I just was showing Jim my t-shirt that I decided to put on this morning as I woke up.
What is it?
Don't hate, meditate. Just we gotta act now, move on.
There you
And
go.
Nice to meet you,
but
Glenn.
you
Nice to
guys,
meet you as well, Jim.
I would have thought you guys met through the Health Excel crew, but maybe in
Well, I
passing.
definitely, I've been at talks and maybe there's been a handshake, but I'm sure you've done quite a bit of that recently, so I can't remember. So nice anyways. Pleasure
Happy
to
to
have
be
you.
with both of you today.
So Glenn, this show that Jim and I do is really for our own mental health, to talk to some brilliant people, learn, and really look forward, shining the light ahead. We've had the pleasure of having many of your friends and colleagues like Lee Shapiro, Rob Garber, Mike Rolla on, and we looked at each other one day and we said, we cannot believe we have not had Glenn. But before we cover your path to where you are today, and while don't want to dwell on last night, I being in healthcare, would love to get your kind of high level thoughts. What happens to healthcare policy starting January?
Yeah. So look, it was a consequential decision for the country, and I think for healthcare, the biggest, as the economists, I think, said early last week when they endorsed Kamala Harris, they said the difference is while you may not love her, you have a good sense of what's going to happen. And with the incoming President Trump, we don't really know what's going to happen. So there's a lot of uncertainty. That's not just in healthcare, that's internationally, that's economically, that's relative to immigration. So there's just a lot of unknowns in terms of how aggressively these various policies will be implemented. Of course, the Affordable Care Act is one issue. It's very hard. We've heard some combination of we're going to repeal it. They tried that multiple times. That didn't work. More recently, we're going to fix it. And we don't know what that means. I think it's too big to completely repeal it. But relative to the government, you have the Affordable Care Act one, you have Medicare Advantage. And Medicare Advantage has been the way that most of our big health plans have been making their numbers. And so the question is, as the government squeezes down on that, what's going to happen to Medicare Advantage and that part of the industry? So I think there's a number of unknowns in terms of what will actually happen. And that's staying away from the whole issue of what's going to happen on medical innovation, medical regulation, the FDA, and almost fearful of saying it, vaccines and those kinds of things. So I think it's just a big unknown. It's a big question mark right now.
A lot of questions.
You alluded to the potentials there, but let's see. We can probably dive deeper and deeper into this, but let's step back for our millions of listeners and viewers. And millions of people do know you, but let's track all the way back. We love to get to know the person and the guest. You can go all the way to birth, both personally, professionally. And the kicker will be, would love to learn some fact about you that nobody else has heard before, if that's even possible. I don't know.
Pretty disclosed.
Sure, well, that's going to be a little tougher. By way of background, I've been very fortunate and to have run, and I'll start current, a number of public-private health and care companies. And the whole goal has always been to work in companies that actually make a difference for people and improve the health and care that I think is a right that should be given to everyone, but particularly to all Americans. In a country as wealthy as ours, we shouldn't have people going without proper health and care. And you'll notice that I talk about not healthcare, but health and care, because the goal of the healthcare system, which is really a sick care system, should be to keep people healthy and outside of the four walls of the hospital in particular. And then when they do need care, to get them care efficiently, effectively, and in a high quality way. And we've mushed all that together, and we have the current broken healthcare system that we're all dealing with, which is the highest cost system in the world and no longer provides the best quality. We do have the best physicians, we have the best facilities, we have the best R&D, and we aren't translating that into delivering that into a high quality care experience for the population. Now, why does that matter to me? And maybe that takes me back a ways. So I grew up, I was the youngest of 6 kids, which meant you had to fight for everything, food and everything else.
Whereabouts?
And in a very competitive family.
And where, Glenn? Where were you born?
I was from the Midwest, St. Louis and Chicago. And then when I was in 4th grade, my father first got the big promotion from St. Louis to the big city, Chicago, and then got another promotion to the even bigger city, New York City. I grew up in New Jersey. So from 4th grade on, I grew up in New Jersey. And then ultimately came back after a little time abroad to Chicago for what I thought would be a short-term stint working with my oldest brother. I didn't know very well because he was the oldest and I was the youngest, and there were a lot of years in between. And so when I moved in 4th grade, he stayed and finished high school, and we didn't have a lot of interactions. So the opportunity, he's a very well-known, noted entrepreneur, and the opportunity to work with one person like that and learn from him was really terrific. And I took that. While I was on the way to go work at a job in Boston, I stopped to meet his kids and never left Chicago, and then raised my own kids here. That said, I grew up in a very competitive household. There were, when you came into the house, there were 6 pictures of all the kids. And when you were not successful or did something wrong, my mom would turn around one of the pictures.
You're kidding.
And so people would walk in and and they'd say, "Jim, Eugene, why's your picture turned around?" And then you'd hear the story over and over again. And your hope is that someone else would screw up worse than you, so their picture would get turned around. Now, depending on the infraction, there might be 2 turnaround at the same time, but that was rare. So
was there
you got the spotlight.
Was there a newspaper stand or a lemonade stand, or is there? We had Drew on last week, and he talked about creating newspapers or creating this.
Yeah.
Was there any of that stuff going on, especially with an older entrepreneurial brother?
Yeah. I've done a number of different businesses, all interesting. First of all, I'm a very amateur magician. We'll come back to that at some point.
Wait,
so
does anybody else know that, or are we the first?
I think other people do know that. So very amateur magician. But I did magic shows. I had doves growing up that I made disappear. I had a leather business. I made leather belts and leather handbags. And believe it or not, these were different times. My mom let me, in 8th grade, take the train into New York City to sell these. Imagine today you'd be arrested for child abuse.
Abandonment.
And then at one point I decided to explore solar, and my mom, who never said no, which was a really wonderful trait, but I said I want to do this solar, and she let me get up on the 2-story roof, cut a hole in the roof to build a solar system. It didn't work. The roof leaked. Many years later, I stopped by to see the people living in the house, and they said the only problem is the roof leaks. And I said, I know nothing about that. But fast forward 25 years later, or whatever it was, when I started a solar business called SoCore Energy, which, along with another great young entrepreneur named Pete Cadens, he ended up, I asked him to come and run it with me, and he took it forward. We sold it to Southern California Edison. But when people said, do you have any experience in solar? I said, actually, I do. And
Yeah.
that was the experience.
You learn what not to do, right?
And that was it. That was a part of it. Actually, there was one good piece of it, and that was the systems we built, which were designed for flat roofs. This all started when I was flying into O'Hare. I saw all of these white roofs, flat roofs, and I said, imagine if they were covered with solar. And that's how that business started. And SoCore was solar commercial energy. And it was and SoCore, the original name was solar, and then commercial, and then the RE was real estate, and that was the link. But what we did was, I went to all those folks with the roofs, and they said, there's no way we're putting anything on the roof that would make it leak. So what we designed was essentially think of it as a rubber panel that the solar sat on top of, so you could have it on the roof without ever linking it or attaching it to the roof and making holes in the roof. So I did learn something. It was many years later. There we go.
Awesome.
I assume, sorry, Jim, I want to go back to the pictures. Just very quick question on that.
Yeah,
Can you
totally.
is that the one you were going to ask? Was that when your mom turned the picture around, or was there another moment? I would love to know one of those.
Many other moments. Again, it's if you want to raise entrepreneurs, let them experiment. And my mom never said no. She would use distraction. She would do other things, but you could ask to do virtually anything, and she would encourage you to do it, even if she knew it was going to end badly. And that was part of this sense of not having a fear of failure, because failure was just learning. And her answer was, did you learn something? And you want to touch the burning kettle? Go ahead.
Yeah. It's funny, Glenn.
Did you learn something? Yes, I learned. Okay, there we go.
So jarring your memory banks, because I'm one of six, and the oldest was the first one to go to university, and she went to Bucknell University. So I know that, and so I remember our whole family, we were all six of us getting in the car and driving up to Bucknell, to this stunning campus up there. So you're at Bucknell. Why'd you maybe bring us into after leather salesman selling and and so what'd you study and how'd you end up in Bucknell?
Bucknell, in part, it was a high academic. It also had football. I thought I wanted to play football. I did play football initially at Bucknell, and then decided I wanted to also go abroad and do other things. And I was fortunate to have played in a very successful state championship football program in high school. And when I went to Bucknell, I found the program in college wasn't as good. And so I lost some of that excitement and really dove into academics. I studied economics and psychology while I was at Bucknell, but I was a poor kid at a relatively wealthy school on a scholarship. And I ended up on weekends working on a local farm for a professor. And he had a heart attack. His wife called, asked if I could come. And this was during the winter. I was on break, come back and take care of the farm. I arrived there. I had to dig out the driveway, all the snow to get to the farm. And then I realized there were animals there. They looked at me. I looked at them. I was a kid from the suburbs. I had seen these animals in zoos, but I had no clue what to do. And the next thing I heard was this clickety clack, and Amish people started to arrive. And they thought this was a funny thing that I didn't know how to milk a cow or any of that. And they took me under their wing, and I had this view into the old order Amish culture that no one else, everyone wanted, and no one could get. And I ended up studying the Amish, and that in part led to my time at Oxford, which was studying social anthropology. So,
oh, wow.
But social anthropology, for years, I've had this question, what's a social anthropologist doing running technology companies? And the answer is that social anthropology is the study of how cultures change. For example, why doesn't the Amish culture change? What do they change? What don't they change? But the fastest way to change a culture, as we've learned, like it or not, is technology. Facebook and other things like that, and all the things we struggle with today, social media, that are having dramatic effects. So it all wove together because you understand technology is a means to an end. It's a way to get people, make life easier for them, get them to do things, give them more choices. So that's a link I made. But it was fascinating to spend time in Bucknell, great school, and I enjoyed it. I struggled a little bit. I was a poor kid at a wealthy education institution, but
Right.
I figured it out.
Fantastic. And then, okay,
Yeah,
then so we've got through some of the, so we've got this
we're al-
entrepreneur that's
we're almost to current time, almost, right? Not
right.
quite, but I guess your entry point into healthcare, right? I just curious, kind of, and you've led many category defining companies. So I think, what was the trigger for you to get into the healthcare, and maybe just quickly fast forward to where we are now?
Sure. And this does tie back to a visit I made to Bucknell, but I entered the healthcare space with a company called Enterprise Systems, and that was focused on resource management inside the four walls of a hospital. How do you make hospitals more efficient and more effective? How do you get them what they need when they're doing surgeries and the like? Atul Gawande got a lot of fanfare for creating lists that said you can make hospitals much higher quality, much more effective by creating lists before you do a surgery, for example, making sure you have everything you need for it, which wasn't done. So that was Enterprise Systems. We took it public. It was a very successful IPO, my first sole IPO. And interestingly, when we took it public, we then sold it to McKesson at a big markup. It was then called HBOC. McKesson acquired them. And I received, and I hadn't been back to Bucknell, and I had a little bit of a chip on my shoulder because I said, I'm only going to go back when I'm as successful as all of these other kids who came, whose parents were successful but had a lot more than I did. So when they all talked about which island they were going to, I talked about going back and loading tractor trailers in a glass factory. And so I was a little jealous, a little chip on my shoulder. And after the IPO, I got an invitation from Bucknell to come back and talk about being an entrepreneur. And I said, maybe this is the moment, and I'm going to make my first trip back. And I went back and was about to speak, and a gentleman came up and he handed me his card. He said, I'll be introducing you. And I looked at his card, and it's Director of Large Gifts. So I realized that the only reason they really wanted me back was to see if I would give a gift to the university. Later that night,
What a card. What a business card,
yeah,
though. Director
yeah,
of
I
Large
think they've
Gifts.
changed those now. But the later that night, I had dinner with a professor of mine who had become a dear friend over the years, and it was one of those seminal moments in life where we were having dinner, and he said, "How do you think you're doing?" And I was feeling pretty good. I had done an IPO. I was pretty young, and so I think I'm doing pretty good. And he was quiet, and I said, "Why are you quiet?" And he said, "I have a different view." And I was perplexed, and I said, help me out. And he said, look, we didn't educate you to make money. We educated you to make a difference. And I don't see it happening. And even now, I get a little choked up telling the story because it was that moment where I said, I've got to figure this out. And he was saying, hey, you became one of those kids that you didn't really like. And at that moment, I said, look, I've got to figure out what I really want to do with my life. And not long thereafter, I went back to Chicago, and this was bothering me a lot. And I went through all the stages. First, he must just be jealous, to maybe he has something, to, you know what, he's right. And not long thereafter, my niece was diagnosed with type 1 diabetes. And so I said, you know what, maybe it's a sign, maybe it's an opportunity. I'm going to join the Chicago board of the JDRF, the Juvenile Diabetes Research Foundation, which is now called Breakthrough T1D. I joined it, and everybody said, what a good person you are. You don't even have a son or a daughter with diabetes.
I think Glenn
on the board,
froze.
and I
Okay,
didn't have
there
the
we
heart
go.
to tell him I was guilted into this. And then, and what do I have to repeat that? So, can you hear me?
I think it caught up. It was
We
like
got it.
very quick, but we got it. Yep, keep
We got
going.
it.
Yeah. So basically, I joined JDRF, the board. 2 years later, my son was diagnosed, and I really
That's right.
dove into doing everything I could because I went to see him in the hospital, and he said, "Dad, can you fix this?" And I did what any parent would do. I said, "Of course I can." And a big part of the rest of my life has been about finding a cure for diabetes and keeping people healthy until we do. So that and the experience with him, if we fast forward, in between there was a little company called Allscripts that we built. And I'll get back to that. But if we fast forward, a lot of people say, "Oh, you built Livongo for your son." And the answer is no, I didn't, because I knew with me as his dad and with a great mom that he had, that he would always get great care. But what I learned about diabetes was how many people weren't getting great care. And that was the opportunity. It was broader than him. But his experience with diabetes, my experience as a parent watching it, and I just said, we make it incredibly hard for people who want to stay healthy. And that's just wrong. And Livongo was about how do we make it easy for people with chronic conditions, beginning with diabetes, to live their life. And that's really what it was about. And the name Livongo came from, we surveyed people and they said, "Look, I just want to live my life and I'm on the go. Don't tether me to a doctor's office or this." It was, I want to live my life, I'm on the go, Livongo, living on the go. And
Oh, I didn't know that.
yeah.
Neither did I.
So before that, though, when I went to Allscripts, the idea there started with electronic prescribing. And we knew, according to the Institute of Medicine, the IOM produced a report that said that each year, more than 6,000 Americans were dying from preventable medication errors. Preventable. That's not all the other ones we couldn't prevent. And that was more than we're dying in the wars we were in and everything else. And it was the equivalent of a plane crashing every other day. And no one was upset about this. And so we looked at as electronic prescribing as a way to improve the experience of the people doing it, but also to save thousands of lives. And what was really fulfilling was that we could put it into a health system. And literally, they had lost 5 people the year before, and they lost no one the next year from preventable medication errors. And when we started, I'd written a memo that said our goal is 100,000 electronic prescriptions this year. And somebody had taken this piece of paper and they had made a big smiley face. And they had said, "Just don't tie our bonuses to that goal," with a smiley face. And fast forward, and we didn't make 100,000 electronic prescriptions. We didn't get our bonuses, or at least our full bonuses. And more than 10 years later, when I was leaving, somebody had saved the beauty of paper. They had saved that memo with the smiley face on it. And they put together this plaque for me that said, "You lost the battle, but you won the war. Congratulations on more than 700 million electronic prescriptions." Fortunately, we had been able to transform that industry. But it was a challenge prying those script pads out of physicians' hands. We joked about their handwriting, but people were dying. But we joked about the errors that were made. So we fixed that. That migrated into practice management. We became the largest in practice management. More than 50,000 offices were using Allscripts systems. And then we went into electronic health records. And this was all outside the 4 walls of the hospital. Ultimately, we bought Eclipsys to move into the hospital. But frankly, the board, at that point, my board had switched from the people who were there originally, who shared the vision, who made a lot of money, to a bunch of professional directors who basically all they wanted to do was just keep making the amount of money we're making, don't innovate. And he said, you have the wrong guy for that. And either all of you can leave or I leave. And that was a real discussion. And so I left. And unfortunately, the leadership that followed tried to do exactly what the board wanted, didn't innovate. And ultimately, the company has been split into pieces. But from there, I went on to start Livongo and then bring us up to speed. One thing, Livongo was transformational. And when people talk about it, they talk about it was sold for 18.6 billion, one of the largest multiples that any company ever was sold for. WhatsApp was above it, but not many. And
amazing.
But they talk about that. The fascinating kind of backstory is when you talk to people who were at the company and we announced it, we made 236 millionaires and everybody was unhappy. People are coming to me and saying, why in the world would we sell this company? I was like, you're a millionaire. It was America. It was really about the experience. They loved working there.
And what I meant not enough, meaning it just from money is not enough. It's the impact, right?
Exactly. It's like America today, which is we have more, people are getting paid more, and they're less happy than ever before. So it's not about money. It was about being a part of something. And when I look at Livongo, I say today, 1 million people every day wake up healthier because of Livongo. Despite the post me leaving, the mismanagement of it, it's still out there. It's still strong. People still love it. And that was one. And the second thing, we created an industry that said you can do 3 things that hadn't been done. Create an experience using digital health that people didn't just like, they actually loved, number 1. Number 2, you could prove they were healthier. And you can't do this in all of healthcare, but in diabetes, you have a blood sugar number day 1, day 30, day 90, and a year later, and you can prove either the population's getting healthier or not. They were getting healthier. And last but not least, we did it at half the cost. And that perspective, that's what launched the big run. Fast forward, we went to the board and said, how do we extend this experience to the rest of healthcare? And the board said, look, let's go out, we'll spend $1 billion, we'll acquire companies. In that process, we ran into Teladoc and we said, look, you're international, we're not. That makes sense. We have this clinical app. 60% of all the calls you get are clinical and you have no solution. And we want to expand into telehealth, and you already did that. And as we went through, there was this beautiful fit. And so we said, look, why don't we put the companies together? We created a plan. We put the companies together. Now, I had already moved on from CEO. And so it all seemed to work. And then at the first meeting, the then CEO, who has appropriately been fired now, but years too late, said, I want to change the plan. So one of the agreed upon tenets was, hey, look, you have 3 great brands, Livongo, Teladoc, BetterHelp. Let's put an umbrella over those and create a new name. That's what you would normally do. And he said, I'd really like the name Teladoc. And I said, you know what? The future of healthcare can't be telephone and doctor. Just can't. That doesn't.
Right. Interesting.
Yeah. And that there were a series of serious blunders, which 6 months in, I had a 2-year term on the board. I told my partner, Hemant, Taneja, the other largest investor, I said, look, I'm going to step off the board and I'm going to sell my stock because I think he has no clue how to run this. This is not a simple telehealth company. This is an information company now, and he doesn't get that.
And Glenn, one of the, just not to, I know, is one of the things that just struck me. So everyone in digital health was watching the Livongo story emerge. And the inspiration that I took out of it, and actually took my own company public, was the articulation of the story, the way the clarity of the story that when I heard, and not knowing you well, but knowing maybe people that knew you, the articulation of the story of how you solved the problem how you brought the business model together. It was really the first time I think we had seen that in digital healthcare, where you made it real for people. You had your own personal experience, but it didn't stay there. It wasn't just if we gave a million solutions to a million diabetics. It wasn't that simple. It wasn't trite. So you brought it in and you brought that story and that business model. I remember I looked at my own company at the time and I started thinking about how could I take some of the tenements of the story, it was a different story, and articulating. And to be honest with you, that still sits with me today as I build other companies, was this articulation, this connecting around the empathy, but then breaking it into a business. And then that allowed people to get behind you in a really elegant way. And it was just incredibly powerful. And I just took a lot for that. You've spawned through that beautiful story and that ultimate success. I think a lot of companies, because they could see that, hey, there's a model here. Just not to interrupt you, but I felt like that was just such a success. And the story
Yeah,
is what
yeah.
people need.
We were very fortunate to have all the pieces come together beautifully. And as I mentioned, 6 months in, I stepped off the board. Hemant, Taneja stepped off the board. And I guess the rest is history. But what I learned from there was that story, that articulation was possible. We could do that for the rest of healthcare. And Transcarent was really about that learning paired with understanding the problem. What everybody was saying, if you survey people today, it's one thing that brings America together, courtesy of the person who created this understanding, Naomi Allen. And what she said is healthcare is more confusing, more complex, and more costly than ever before, and it's getting worse. And whether you're young or old, male or female, ethnicity doesn't matter. Everyone feels the same way. And when I went out to Silicon Valley and I moved out to Mountain View during the Livongo days, what people said is, we don't understand healthcare. There's so much friction. You put copays and co-insurance and claim reviews and pre-authorizations in front of people. And what we do in Silicon Valley is we make it easy. We build apps that make it easy for people to do whatever they want to do and whatever we want them to do. And if you look at every other industry, banking, you can bank on your phone. Uber, you order a car in minutes. And it's almost, you still look at it sometimes and say, that's amazing. And you go to Travelocity and you book your travel. And in healthcare, the middle has expanded and has gotten worse. So we said, what if all your health and care in one place? And that was the vision. And the mission was really based around one word: making it easy. How do we make it easy for people to access high quality, affordable health and care? And so you see that access word 24/7 and quality first, really important to build trust, and affordable, really important. And then that division of health and care. And that's the story of Transcarent. And so today we have a wayfinding app, which is, think of wayfinding as the combination of Google, which is any information you need instantly, paired with Amazon, any action you want to execute, like buying or getting healthcare, all in one app, completely easy to use, inexpensive, a third of the cost of anything else out on the market. And we created a category, which I like to do. So instead of saying this is the traditional expensive navigation like a Quantum or an Accolade or an Included, what we said is we're creating a whole new category that uses generative AI paired with real live physicians, real quality, does it for a third of the cost. And any question you want to ask in 100 different languages is instantly answered. Like, that's what we've created, and that's going to transform all of healthcare.
Glenn, you mentioned, and I alluded to this earlier on the category piece, right? We've talked about building a business is hard. Building a business in healthcare is even harder. But building a new category, which means that you have to explain to people what is it versus knowing, is even tremendously harder, right? So I know you have big aspirations, but what would you give as kind of the pillars of building a category, right? A category defining business?
Yeah, again, category creation is interesting. The shortcut to that is different, not better. So if I had to pick three words, different, not better. So when you, and you're both old, I'm old, flip
Hey.
phone. We all had flip phones. And when the iPhone came out, nobody said, oh, that's just a better flip phone, right?
Mm,
So they said the flip phone did one thing, and that was make calls. The iPhone gave you the ability to do everything. It was wholly different. Better is, hey, I'm better than you, and tomorrow you're better than me, and it's a feature game. Different is so different that you can't, it's almost a new category.
you
And the
can't compare.
only reason that they call the iPhone a phone was to create that link. So you could say you can use it as a phone, but today kids under the age of 30, I think, use the iPhone for phone calls like 8% of the time.
Right,
So is it
right.
really a
If that.
phone? Yeah. So we don't even know what it is. So wayfinding was so different. And we wanted to create a new category that said this is using generative AI. It's any language you want to speak to it in. If I say no entiendo, it comes back and starts speaking Spanish. I don't have to say, please speak in Spanish. It is so intuitive. And I can ask any question on benefits navigation, on clinical guidance, and our care delivery. I can say, what's our coverage policy? And might say, we cover 80%, you pay 20%. But that's not actually what I wanted to know. What I wanted to know is how much is it going to cost me?
Yep.
If you ask that question to our wayfinding app, what it would say is it's 80-20, but you probably, without you asking, you probably want to know what it's going to cost you. Eugene, your limit is $3,000 a year. You've already spent $970. So the maximum this could cost you is this amount. But if you go in network, it will only cost you this amount. You're like, whoa, that's everything I was going to ask. Or you could simply say to it, the trick about navigation is when we get in our car and we use a navigation system, we know where we want to go. In healthcare, people say things like, my shoulder hurts. And so what our app would say is, if your shoulder hurts, and if it hurts badly enough, you have three options. We have an orthopedic consult you can do over the phone. You could go see a doctor locally. And if you go to an in-network doctor and we can schedule it for you, we can get you an appointment. In some cases, here's your choice of appointments. Or you can have surgery, but we wouldn't recommend surgery without a second opinion.
Or you
Then
could stop
last,
going like this. Stop going like
yeah,
this to your
yeah,
shoulder.
exactly. Yeah. And then last
Glen,
but not least, care delivery, which is, hey, my sinuses hurt. I'm getting discharged. I have a headache and I want to talk to a doctor now. And in 60 seconds, you're texting with a doctor. And just like with Uber, what I find amazing is maybe it happened to you. We look at Uber now and it says 8 minutes and we're pissed. We're like, I'm not waiting 8 minutes.
Yeah.
And so,
Yeah.
wait a minute,
but that's
remember,
why
like,
they tell you two now, and then you still end up
yeah,
waiting for eight, right?
exactly. But they changed our expectations, and we're doing that in healthcare
Right.
for companies now who are saying people deserve instant answers and instant access. And that's what we're delivering.
Glenn, there's probably two to three more questions, and we're going to try to get you out on time. I know you're a busy guy, so maybe if we can hang on an extra three or
Sure.
four. But one
Yeah.
one quick one around, you're known as one of the greatest business builders, salespeople out there. We had some members of your team from previous companies that learned a lot from you. In maybe a minute or two, which I'm sure you can do a whole class back at Bucknell on entrepreneurship and selling, some key points. And I'm going to remember one comment. You and I had a discussion around people not getting back to you, et cetera. And I said, I take it personally. And your comment was, to my surprise, you should take it personally. That was just like one of these things that I think it's valuable to our
Bit of
guests and
wisdom.
listeners to hear from you on this.
Yeah. Look, the shortcut is first and foremost when you're building businesses, do what you love. Number one, make sure you're making an impact because otherwise you're successful and what? Nothing. And so do what you love, make an impact would be the second thing. The third thing I'd say is keep learning, and in the sense of learning, like we've started many businesses and we pivot once or twice before we get to what we're actually going to do. And it's funny to go back to, I hate to bring us back to the campaign, there was this question of, did you flip flop? And the easy answer should have been, no, I did something called learning. If you go down a street and it's blocked, the next day, you don't do the same thing, you change. Hey, you know what? You flip flop on, fracking. No, I was representing California. They don't like it. Now I'm representing the whole country. And I changed my view. That's called learning. Do what you love and make sure you're going to make an impact and keep learning. And the last one is have fun, because this is hard stuff. And if you're not having fun, creates energy, it creates positivity, it keeps you healthier. And that's the corollaries to that. Don't take yourself too seriously. We take our business seriously. We don't take ourselves too seriously. And so those are the points.
Before Jim's last famous question at the end that he always asks, I know you guys just recently made an announcement, a partnership with Evernorth. And I know part of this is when we talk about health plans and PBMs, there's a lot of noise around it. There's a lot of profits on one side and managing people's health. On the PBM side, we know the stories here. Again, there's many reporters and journalists out there that have been reporting. What was the trigger for you guys? It seems like a perfect partnership, but curious to learn from you and how you look at on one side, how do you look at the deal?
Yeah, first and foremost, I'd say that we're in an interesting time, and there are friends and enemies and frenemies. Sometimes they're all three. So at Livongo, Amazon was a great client of ours. They were a co-development partner, and they were also doing things that trying to compete with us. And sometimes our people would say, they're competing. They are over there, and over here they're not. When I look at the structure of both PBMs today and payers today, look, there's a lot of good people there who want to do the right thing. Yep. And some of those PBMs and payers are saying, we have to get more customer focused. We have to create new kinds of experience. And in order to do that, we're going to partner with people who do that. And they're innovative. They're going to survive. They're going to prosper. And that's great. There's other ones who say, we know it all. We're going to do it the same way. We want to maximize profits. And in Evernorth, we found an innovative partner who was looking for solutions. Evernorth was created to be the services company for Cigna and for Express Scripts. They took the best of both, and they put it together. And so we're really proud to partner with them to bring these innovative solutions to more than 20 million people will be offered those solutions. So that's just smart. So I think in every industry, you can find people who sometimes say, we got to innovate, we have to change, otherwise it's going to be done to us. Tonight, I'm interviewing Pat Geraghty, and from Guidewell, Florida Blue. Pat is an innovator. He's constantly, everybody's going this way, he goes that way. How is he positioning for the future? So those are the kinds of folks we want to partner with.
Just a quick comment on that. I don't think I've ever seen you in the interview chair, you being the moderator and the interviewer. You're always the interviewee. I love it. I can't wait to see this one.
Anytime I can get somebody smarter than me, I want to ask them a lot of questions. And I'm not saying people are like, hey, it seemed like you wanted to know the answers to those things. And I was like, yeah, I didn't care about the audience. Here's what I wanted to know.
Fantastic.
Listen, along this journey, I wish we had 3 or 4 hour podcast, because I think there's just so many things that we would have loved to double click. And I know we had very limited amount of time, Glenn. So I am going to go and pass the baton to Jim Joyce as he positions his last question before we let you go.
Great.
Okay, Glenn. So we're gonna head into the future. So we're 36 months from now, and 20 million people, more than 20 million people, have been offered this transformative service from Transcarent through the Evernorth deal. And as a result of it, Bucknell decides to create an annual conference called Making a Difference Conference, and they've asked you to keynote this conference and open this up. And you're up delivering it, and they said, Glenn, we don't just want this to be any conference. We want you to talk about cutting roofs into solar panels and
By the way,
pictures,
the people that called you did not have that title in the card. So just
posting about hanging photos of people when they were doing a good job. And we want to talk about building leather tools and bringing companies public and all this stuff. But we want to hear the whole story. So you give up and you give this amazing talk, and it's just different. You feel the energy. You feel like you've made this difference, and you can feel people being inspired. But this one young New Jersey raised, Chicago born, St. Louis born, Chicago kids raised his hand from the audience. He said, Glenn, I got to talk to you. And he runs through, I've been working on an Amish farm for the last year, and I've been studying social anthropology, and I've done all these things. And now I'm setting up to start my first transformative, making a difference digital healthcare company. And you look at that young version of yourself, what's the one piece of advice that you would give them?
I would say go for it.
Love it.
don't be afraid to fail.
Yeah. I like to say, and maybe it's a good way to end, and that is innovation begins by doing something, not by talking about it, by doing something. That's when the learning starts. That's when the progress starts. That's what I would say, dive in, because there's so many times you've heard people say, there's some great idea, and somebody says, I had that idea. Yeah, you know what? You didn't do anything about it. That's the thing. Innovation begins by doing something.
Love it. And thank you very much for making the time.
Thank you, guys.
And
You're
we'll
the
talk
best.
soon.
Appreciate
Take
it.
care.